Face fit testing has been a requirement within COSH since 2002. When using tight fitting RPE, it's important to make sure the mask is actually fitting correctly, and a face fit test will ensure that this actually happens. When conducting face fit testing, the guidance that should be followed is the HSE OC 282/28. Other useful guidance is HSG 53, which is the Respiratory Protective Equipment at Work, and the EH 40, which is the Workplace Exposure Limits. The types of RPE that should be fit tested is anything that's classified as tight fitting. That can be anything from a disposable through to negative pressure half masks, cartridge respirators, full face masks, and even BA systems. What doesn't need fit testing is anything classified as loose fitting, which could be a hood, a blouse on, or an air-fed system, which doesn't actually create a seal around the face. Other reasons that you would conduct regular face fit testing would be company policy, significant weight gain or loss, substantial dental treatment, facial changes such as a broken nose, broken jaw, mole, scar, or if you change your RPE. The two main types of fit testing that is generally conducted is qualitative and quantitative. This is the qualitative method, which is generally regarded as the taste test. The kit consists of a hood, two nebulizers marked A and B, sensitivity solution, test solution, full instructions for use in hard copy and DVD. The nebulizers are clearly marked A and B, and these produce a mist. The A nebulizer should be used for the sensitivity solution and the B nebulizer for the fit test solution. Before conducting face fit testing, you need to ensure that you have good preparation. You need a well ventilated room, still drinking water, glasses or cups, tissues or face towels, non-scented, a mirror, and obviously the masks that you're going to face fit test. When conducting a face fit test on an employee, the employee must be clean shaven in the area of the seal. They shouldn't eat, drink or smoke for a minimum of 15 minutes prior to the test, and they should have other PPE that would compromise the fit of the mask. To conduct a sensitivity test, take the A nebulizer and the sensitivity ampule, and by squeezing the ampule you will hear a cracking sound like that. Okay, squeeze the solution in and make sure it all goes in. This ampule is now empty and should be disregarded and thrown away. Before replacing the top, make sure that the atomizer is there and that the black O-ring is in place, and then just screw the nebulizer back together. Remove both plugs, and that is ready for use. The purpose of the sensitivity test is to establish whether the actual wearer of the mask, who's going to have the fit test conducted, can actually detect the taste. The hood is designed to go over the head. It has a hole in the middle of the visor for inserting the nebulizer, and it has two Velcro straps that are designed to be worn under the arms to hold the hood in place when the fit test is being conducted. When conducting a sensitivity test, it's important to make sure you've got the A solution. You remove both plugs, check that the nebulizer is working, ask the wearer to actually open their mouth and breathe through their mouth, and you don't point the nebulizer spray straight into the mouth. You're pointing up the side to make sure that the solution is going into the hood and not straight into the mouth. So I'm going to start by putting in up to 10 squeezes, and if you can tell me when you can taste it. Thank you. Okay, thank you. When the test subject has detected the taste and you've established a sensitivity level, it's important that they have a full glass of water and they wipe their face with a tissue or a paper towel. There are 3 different levels of sensitivity which will be applied during the test exercises. They are determined by the number of squeezes of the nebulizer. If the test subject detects a taste between 1 and 10 squeezes, the level is established as 10. If the test subject detects the taste between 11 and 20 squeezes, the level is established as 20. And if tasted between 21 and 30 squeezes, the level is established as 30. When conducting a fit test, it's always important that you give clear instruction and a good demonstration of how the mask should be fitted. This particular mask has a clip. Put the mask to the face, one strap around the neck, the other strap on the crown of the head. Adjust it, pull the straps together, and that is how the mask should be worn. When the mask has been fitted, you should conduct a fit check. This is done by covering the mask with your hands and blowing sharply. Other PPE, such as safety eyewear, that is used during a daily task should be worn when conducting the fit test exercises. To conduct an actual fit test, take the B nebulizer, remove the lid, take the fit test solution ampule, squeeze again, exactly the same as with the sensitivity. Squeeze that in, all that solution into the nebulizer. That should now be disposed of. Replace the lid of the nebulizer, screwing it into position. Remove both plugs. That's ready for a fit test. Place the hood over the test subject as in the sensitivity test. Then take the nebulizer B, remove both plugs, check that it's working, and then insert into the hood like so. Prior to starting the first exercise, put the number of squeezes established in the sensitivity test into the hood. Start the first exercise, which is normal breathing, asking the test subject to breathe through their mouth. Each exercise lasts for a duration of 1 minute. You should apply half the number of required squeezes every 30 seconds. Second exercise is deep breathing. So if you could take some deeper breaths for me, but without hyperventilating. Exercise 3 is turning the head slowly from side to side. Exercise 4 is moving your head up and down. Exercise 5 is talking out loud. And what I'd like you to do is to count out loud backwards from 100.
99, 98, 97, 96, 95, 49, 48, 47, 46.
So the next exercise is bending over, and what I'd like you to do is to just bend slowly and then back up, and just keep doing that slowly. The last exercise is the same as the first, which is normal breathing, so nice and relaxed, breathing through the mouth. Another way to demonstrate the mask has been effective is to break the seal before the hood is removed. Ask the test subject to place their thumb between the chin and the mask and pull it forward, then breathe in. Every fit test needs to be recorded, and a template is supplied with every face fit test kit. If the test subject detects the taste during the test exercises, it is deemed as a fail, but should still be recorded. For further assistance regarding face fit testing or any information of the product range, please contact Alpha Solway.